Is the screen visible, sir? Okay.
Yes, perfect.
Okay, sir. I will start the presentation then. In our previous session, we spoke about the medicinal uses of cannabis in the 19th century in India, mainly taken from the Indian Hemp Drugs Commission's report. Today's session, I want to talk about the medical uses of cannabis across the world as it is happening in the current scenario. The content of my presentation roughly mirror what I used in the previous session. So I'm talking about treatment of communicable diseases, treatment of non-communicable diseases, how cannabis is used in pain management, the different sections of society that use cannabis, the conditions for which cannabis is being prescribed today, the main conditions as well as different kinds of conditions, how the medical cannabis industry is functioning, different methods of administering cannabis in today's world. And also I will talk about what challenges cannabis as medicine faces today briefly, as well as why cannabis meets the requirements of universal medicine that can be used as the most potent medicine for universal healthcare. So, talking about the treatment of communicable diseases, we see that cannabis in today's world is not being used as extensively as it was in the 19th century Indian context for communicable diseases. I've come across places where references are shown of it being used to treat tuberculosis. So, this was mainly from a nutrition study in Czechoslovakia, where they said that hemp seed is good for it's the only thing that provides sufficient nutrition for people suffering from tuberculosis. We see cannabis being used in today's world for HIV treatment, though it is not directly to address HIV, but it helps to the patient to live a better quality of life despite having HIV. So the way that cannabis is being used is it helps to increase appetite. We can see that uh, it is it also can indirectly help to reduce the spread of HIV. We see that the incidence of HIV is 22 times more likely with persons who use inject drugs using needle and syringe. So that is one of the primary methods in which HIV spreads in the world today. By using cannabis instead of the drugs that people inject into themselves, the one of the main pathways of the spreading of HIV can be reduced. Now, we find from studies that people who use cannabis have better neurocognition when it comes to people who have not used cannabis, that is, among people who have HIV. There is clinical evidence that shows that cannabis alleviates HIV-related neuropathic pain. There are studies that say that since cannabis is a potent anti-inflammatory medicine, it can help to reduce the HIV pathogenesis-related inflammations. It can I think both Cambridge and the Oxford University Press have published reports or studies in which the same benefit is discussed. As I said, in today's world, we don't see any of the infectious diseases that were treated in the 19th century India being treated with cannabis, such as malaria, cholera, dysentery, influenza, sexually transmitted diseases. In all these cases today, allopathic medicines are being used. We see that most of the synthetic pharmaceutical medicines that are used are in the form of antibiotics, antivirals, antifungicides, and vaccines to try and prevent communicable diseases. Because of this scenario where there's a extensive reliance on synthetic pharmaceuticals, we typically see that it's only the developed nations or the rich people in countries who can afford these kind of medications in the especially at times of crisis, as we saw during COVID and situations like that. Now, with regard to cannabis for the treatment of non-communicable diseases, I'd like to talk about the human body systems and the diseases or illnesses that cannabis treats. I'd like to talk about diseases which I call lifestyle diseases, essentially, but I think there are multiple factors which have come about, and these diseases are showing more prominence today than in the past, and also talk about some of the rare diseases that cannabis is being used to treat. So in the diseases of the body systems, regarding the head, we find that the cannabis has many properties which enable the treatment of head and brain problems. So we see that cannabis is neuroprotective, it is neurogenerative, um, it reduces inflammation in the brain cells, it is antioxidant, it increases cerebral blood flow, it's a mood regulator, and it also helps in erasing memories, which we will see why this is beneficial. Now, studies have found recently that the brain has one of the highest concentrations of the endocannabinoid receptors. Along, I think the digestive system is another area with very high concentrations. So cannabis acts on the brain, primarily on the brain stem, the amygdala, hippocampus, hypothalamus, and the interaction happens primarily through the cannabinoid receptors CBR1 and CBR2. The conditions that are being treated with cannabis in today's world are dementia, Parkinson's, brainstem stroke, traumatic brain injury, autism, epilepsy, drug craving, and various aggressive brain cancers like glioblastoma. Um, from these conditions, we can see that many of them have to do with damaged brain cells. Many of them have to do with problems of blood flow and various causes. But the treatment that cannabis provides seems to be effective in all these cases. For example, for treating conditions like Alzheimer's, schizophrenia, and PTSD, the ability of cannabis to increase the cerebral blood flow has been found to be beneficial. Its mood regulator properties have been found to be especially good in treating conditions like anxiety, depression, and bipolar disease. And the ability of cannabis to help us erase typically traumatic memories helps in treating conditions like PTSD. I'll talk a little bit more about PTSD and how cannabis works further down. Uh, the one of the main uses of cannabis today is it helps to heal the brain that has been damaged by exposure to highly addictive and damaging substances like opioid. It helps to treat uh, addictions of cocaine, methamphetamine, alcohol, and tobacco. In all these cases, it's neurogenerative and neuroprotective ability to treat these conditions. It has been found in study that the use of cannabis is not linked with ischemic stroke, which I understand is basically the stroke that happens in the brain. Some of the important findings are that THC or delta 9 tetrahydrocannabinol is especially good for certain conditions, such as PTSD, for example, where it lowers the reaction of the amygdala to potential threats. What happens in PTSD people is that there is a amplified reaction to perceived threats, which causes immense stress for these people. THC has been found to be especially beneficial in treating traumatic brain injury, obsessive disorders, and also for conditions like chronic insomnia and migraine. So from these studies, we see that contrary to what most people regard THC as an evil, or the main reason why cannabis should be banned, we can see increasing studies showing why THC is actually the most beneficial compound in cannabis. Studies have shown with relation to um, medical conditions of the head that you can use cannabis to treat glaucoma, and the primary way in which it is beneficial is that it reduces the ocular pressure for typically 3 to 4 hours after one has consumed cannabis. Speaking of the diseases of the lungs, um, a study was published in Nature speaking about how cannabis can help with lung inflammation and how it could be a potential medication for COVID. This happened around the COVID time. Other studies show that the antibiotic property of cannabis helps to reduce acute respiratory distress syndrome. There is a report in British Medical Journal case reports about how daily consumption of cannabinoid extracts helped a person with lung cancer. We see that people who typically suffer from chronic obstructive pulmonary disease have been found, those who use cannabis have been found to be less likely to die in hospital and have a decreased risk of pneumonia, as well as the amount of time that they spend in hospitals is typically lesser than people who do not use cannabis. With regard to the many people have the argument that tobacco and cannabis are equally dangerous, and that both are therefore equally injurious. But many studies show that the cannabis exposure does not negatively impact lung the way that tobacco does. We also see that it is not a significant risk for lung cancer. A third study which compares tobacco and cannabis says that people who use cannabis in a longitudinal study of over 20 years it was found that the lung functioning of cannabis users was much higher than that of tobacco users. So the two measures that were used was the forced expiratory volume in per second expiration and the forced vital capacity. This was published in JAMA network. We see here that the traditional uses of cannabis in India, which was like for treating asthma and bronchitis, is not seen to be practiced much these days. Speaking about the heart, as we may all be aware, the number one cause of communicable death in the world today are cardiovascular diseases. There are various heart conditions that typically cause problems, such as atherosclerosis, myocardial infarctions, cardiomyopathy, myocarditis. The factors that contribute to heart attacks are hypertension, high blood pressure, high levels of total cholesterol, triglycerides, and low HDL. The way that cannabis has been found to be good for the heart is, again, it is not directly being used to treat a heart attack or a heart condition, but it helps. It is a preventive mechanism. What has been found is that people who use cannabis have a much better or healthier body mass index. They are more slimmer and less likely to be overweight. And they also have lower waist circumferences, which are all conditions or factors that play a key role in heart disease. It has been found that cannabis lowers metabolic syndrome, which is again a risk factor for type 2 diabetes and heart disease. Some studies say that cannabis may reduce high blood pressure. We all know about the anti-inflammatory properties of cannabis. Some studies have shown that people who use cannabis are less likely to have irregular heartbeat, a condition called as atrial fibrillation or AFib. Regarding atherosclerosis, the benefits of cannabis has been found to be how it again shows anti-inflammatory responses. The journal Springer has a study that says that whole extracts of cannabis can help in the initial phase of atherosclerosis. A study says that older adults who used cannabis for 3 months continuously had less systolic and diastolic blood pressure values dropped. Another study again talking about hypertension says that it is cannabis use is not associated with incidence of hypertension. A study published by Normal talks about how cannabis helps to reduce the harmful total cholesterol, triglycerides, and LDL. A report in Hindavi journal talks about how people who have myocardial infarctions, those who use cannabis appear to have less damage of tissue as compared to those who do not use cannabis. Again, the same property is discussed by MDPI in one of its studies, talking about how CBD decreased organ damage. We also see that the link between cannabis and cardiovascular disease is almost non-existent when we take into consideration the other likely factors that lead to heart disease, such as body mass index, tobacco smoking, and alcohol use. Again, another study from Normal also talks about another lack of association between marijuana use and atherosclerosis in the general population. One of the things we see is that certain synthetic pharmaceutical medications that we take quite frequently and quite regularly and almost treat as harmless, such as paracetamol, has been found to have links with cardiovascular disease and hypertension, as reported by Wikipedia. Again, overall, how cannabis can help with keeping the heart healthy is that by using cannabis, a person reduces their consumption of alcohol, tobacco, synthetic pharmaceutical drugs, and other factors that can lead to heart disease. In diseases of the digestive system, we see studies that talk about cannabis being used to treat cancers of the colon, pancreas, and rectum. Like I said, digestive system is another place with concentration of endocannabinoid receptors like the brain. So, as we know, many people believe that the digestive system is another kind of brain. The brain and the digestive system together work in coordination to what you call good health. Cannabis has been used to treat ulcerative colitis, endometriosis, inflammatory bowel disease, all medical conditions that affect the digestive system. I spoke earlier about how cannabis helps HIV patients by increasing their appetite. That also helps even cancer patients to get the required nutrition. A study in clinical gastroenterology talks about how patients with gastroparesis who consumed cannabis were likely to spend less time in hospital than non-cannabis users. A study in Nature spoke about how cannabidiol reduces or heals the alcohol-induced injury to the liver. Another study in Frontiers in Pharmacology, which again is similar, talks about how cannabidiol prevents not just damage through alcohol, but also through high-fat, high-cholesterol diets. It has been found that cannabis users were less likely to suffer from liver damage through non-alcoholic fatty liver disease, which affects people who don't even use alcohol and is quite prevalent these days. One more study talks about how hemp peptides have potential therapeutic interest in treating liver cancer. Again, on another note, we see that besides alcohol and tobacco, some of the synthetic pharmaceutical or most synthetic pharmaceutical medicines that are being used today, sooner or later, have catastrophic damage on livers and kidneys, which are primarily the two organs that process toxins in the body. So we see that in the United States, UK, Australia, and New Zealand, the number one reason for acute liver failure is the overuse of paracetamol. In diseases of the body systems regarding the bones and tissues, cannabis is being used these days to treat skin, to cosmetics and wellness, to treat the skin and heal wounds. It is being used to treat spinal cord injuries, especially to aid in recovering and handling pain. It has been used again for treating broken bones. Again, in all these cases, I think the role that cannabis plays is its analgesic or anodyne anti-pain effects, as well as its anti-inflammatory effects, its ability to promote sleep and appetite, and all these things which together help the person to rest and heal better. We know that cannabis is being used today for relieving muscle fatigue, especially among sports persons. The wellness industry uses cannabis in various forms, such as oils, bath salts, balms. Cannabis is being used to treat various kinds of painful arthritis, and also as it is being used as an aphrodisiac in the similar ways that it is used for wellness. Now coming to lifestyle diseases, I spoke so far about the diseases that the various body parts that are being treated with cannabis. Um, in terms of lifestyle diseases, I like to first talk about cancer. I call it a lifestyle disease mainly because some of the main factors that contribute to cancer today have all come about in the last 150 years, such as the introduction of fossil fuels, the introduction of pesticides, fertilizers, the synthetic pharmaceuticals, all the synthetic man-made creations have resulted in spiraling of cancer these days, which is why I call it a lifestyle disease, because we have changed the way that we live today as compared to, say, 200 years back. Cannabis for treating cancer has been in the news for a long time now. There have been reports of, there are multiple reports that keep coming out of how cannabis has helped in various situations. The properties of cannabis that help it to treat cancer are it aids in the timely death of the cell. As we know that one of the main symptoms or the problems of cancer is that cells do not die when they're supposed to, but they grow profusely and continue to grow. It reduces the proliferation of cancer cells from one area to another. It also promotes the destruction of the cancer cells. We see that the various kinds of cancer that are being treated with cannabis are vast. Basically, you see that there are diseases of the brain, of the pancreas, the white blood cells, the skin, prostate, digestive system, lungs. So cancers of every part of the body are being studies are showing that they can be used to you can use cannabis to treat these. Some of the main reasons why this is is probably because of the way that it can be delivered in multiple ways at multiple doses to aid in treating cancer. We also see that even more than the direct treatment of cancer, there is the popularity of using cannabis is extremely high to kind of to reduce the effects of chemotherapy. So many people are using cannabis to help them to overcome the nausea, pain, loss of appetite, depression, anxiety, and sleep disorders that all come with the fact that a person knows that he or she has cancer, and also the subsequent highly toxic treatment that comes from conventional chemotherapy and radiation, etc. One thing, when we see all these things and we wonder why is it that there is no, why is this use of cannabis to treat cancer not being followed when there is so much of widespread suffering due to cancer? One of the things that we must remember is that the cancer drugs of the synthetic pharmaceutical industry are the top revenue earners for the pharma industry. So the benefits that come to the synthetic pharmaceutical industry from having cancer, um, uh, should I say, maintained at its current levels is quite interesting to consider. In the lifestyle diseases, obesity, as we know, is a big problem in today's world. It's increasingly becoming a problem with we are seeing children being obese, the elderly people being obese, the middle-aged people. Everything again has come about because of our lifestyles, our disconnection from nature, and the less attention that we pay to our bodies. And as we know, obesity is linked to various diseases such as diabetes, heart conditions, and of course, structural weakness. A report says that by 2050, 1 in 5 Indians will be obese. How does cannabis help to fight obesity? It improves the body's metabolic function, which, other things, helps to break down the food that is consumed efficiently. Uh, it has been found that the body mass index of long-term cannabis users is lower than the average non-cannabis user. The waist circumference of a cannabis user has been found to be lesser than the average general population. Studies have shown that there is this typical stereotype that a cannabis user is a lazy person who just lies down or lazes around and just smokes ganja and does nothing. But various studies have shown that the cannabis user is much more physically active, much more physically fit, and spends on an average about 30% more time in the gym as compared to the non-cannabis user. Lifestyle diseases, talking about anxiety. Anxiety is again another growing lifestyle disease that is increasing in the world today as the world does all kinds of things to increase anxiety levels. We see that conventional treatment for anxiety has been essentially synthetic anxiolytics and benzodiazepines. Um, these conventional synthetic pharmaceuticals are known to have serious side effects such as causing confusion, drowsiness, nausea problems, constipation, muscle weakness. Benzodiazepines are, of course, most widely used. Regarding benzodiazepines, we see various warnings have been issued. For example, it is listed in the Beer's list of inappropriate medications for older adults because it has many short and long-term adverse risks. It has been found that people with generalized anxiety disorder show improvement with cannabis products. The presence of THC again is evident here. The fact that higher THC levels appear to be more beneficial for anxiety treatment is something that appears in a study here. We see that in the US, in the states where cannabis has been legalized, either medically or for adult recreational use, the proportion of Americans who are using cannabis to address anxiety is much higher than the states in the US where it has not been legalized. We see that more than half of the consumers of cannabis have replaced some or all of their prescription medications, preferring the cannabis treatment to the dangerous side effects that they have experienced from the synthetic pharmaceuticals. We see that with availability of cannabis, there is a significant decrease in the anxiolytics sold. There is a significant decrease in the sedatives sold, and in significant decrease in the antipsychotics that are sold. So uh, it can address three whole classes of synthetic pharmaceuticals that are being used typically to treat anxiety these days. The combination, if you ask me, of these three classes of synthetic pharmaceuticals itself can cause very serious damage to the human health. We see cannabis does not disrupt a person's sleep cycle, unlike the synthetic pharmaceuticals. This is especially for a person with anxiety. I think less sleep is also a contributing factor. We see among the lifestyle diseases. I spoke briefly about post-traumatic stress disease disorder. We see that again, like anxiety, PTSD is growing in the world today. Some of the kind of factors that have been found to be responsible for PTSD are like family issues, childhood neglect, being close to violent situations, being a victim of domestic abuse, or serving in the armed forces and being in combat situations. These are some of the causes of PTSD. It has been found that in the US, more people use cannabis for reducing their stress and improving their mental health than for any other reason. I spoke briefly about how THC dosing helped to reduce the threat-related hyperactivity in PTSD patients. We also I had also already discussed about the benefits of THC for suppressing averse memories and, of course, fighting anxiety. Various studies again speak about the benefits. So the Journal of Basic and Clinical Physiology and Pharmacology talks about how cannabis has been shown to be an effective treatment. Another study reported in the media, the Fresh Toast, spoke about how people who used cannabis were more than 2.5 times likely to be certified as having reduced levels of PTSD. Again, I spoke earlier about how the cerebral blood flow increasing benefits of cannabis help in various diseases, including PTSD. Fourth lifestyle disease that we see commonly today is sleeplessness. Again, these are all they all probably come together. The lack of sleep, the stress, the anxiety, and possibly the cancer and the obesity, they all probably have likelihood of being interlinked. So for treating sleep disorders, we see that cannabis has been found in multiple places to be effective. So older people are found to be able to sleep extra 30 minutes typically when they use cannabis. You can see the percentages, like the significant number of people of those studied show benefit. Again, in this, we see that it is helping people to reduce the use of benzodiazepines and alcohol. It has been found that some studies say that the indica strains appear to be better than the cannabis sativa strains for promoting sleep. In terms of the rare diseases, we see in many places that cannabis is being used when all other conventional treatment methods have sort of hit a dead end or a stone wall. So we see that cannabis is being used for rare forms of epilepsy. Some of these forms of epilepsy are quite devastating and quite, especially when it happens to children who are born with these conditions. Some young babies are known to go through hundreds of bouts of epilepsy in a single day and may not live beyond their younger days. So cannabis has been found to be quite effective in multiple studies to treat conditions such as Dravet syndrome, Lennox-Gastaut syndrome, and temporal lobe epilepsy. It is being used in multiple studies show its use for the treatment of fibromyalgia, again, which is in the form of pain management. Again, in multiple sclerosis, all these three rare diseases, multiple sclerosis, fibromyalgia, sickle cell disease. Again, the role that cannabis is playing appears to be focused on the pain management aspect, which these studies are showing. Pain management itself is probably requires a dedicated focus because across the world, pain management is probably the number one use of cannabis. Again, the conditions that we live in the world today has meant that there is a spiking of pain, not just physical but also mental. The US National Institute of Health says that in the US alone, about 17.6% of people suffer from severe pain, and about 11.2% people complain of daily pain. I think in a place in maybe or even in the other poorer countries, these levels of pain might be much higher. The various kinds of pain that people suffer include the musculoskeletal pain. We see pain basically in every part of the body. Not only that, but also pain due to the illnesses that we typically suffer today. We see that the number one treatment for pain is opioids, and essentially the best opioids are only available to the richest countries and to the upper classes of a country. The United Nations Office of Drug Control report in 2020 said that at that time itself, about 5.5 million people suffer from terminal cancer, and more than 1 million people from end-stage HIV/AIDS without access to an effective painkiller. The number one painkiller used around the world is paracetamol. China is the largest supplier of paracetamol. Together, India and China produce about 70% of the paracetamol in the world. We also see that ibuprofen is also, we see that paracetamol is essentially used for treating pain, while ibuprofen is used to treat inflammation. So two different drugs to treat something that typically is connected, such as pain and inflammation. We see again that China is the largest supplier of ibuprofen in the world. India is the second largest supplier of ibuprofen in the world. We see aspirin is also used widely, and the extensive use of aspirin is present in North America. And again, essentially, the bulk of the aspirin comes from China. So we see that the painkillers that are used today in the world, the top painkillers, the opioids, the paracetamol, ibuprofen, and aspirin are essentially coming from one or two places, and these two places are the manufacturing hubs of the synthetic pharmaceutical industry, and China provides active pharmaceutical ingredients to countries like India also to produce its synthetic pharmaceuticals. What are the drawbacks of what is happening? We see that opioids are very effective for pain relief without a doubt, but the addiction that comes from the opioids, not only the prescription opioids, but also the illicit heroin and other opioid drugs, is causing devastation to addiction and overdose. Every year, this number, 69,000 people dying of opioid overdose every year, was, I think, something like in 2021. But I think by 2023, this is in the US alone, I think about 81,000 people died of opioid overdoses. Again, who are the leading manufacturers of opium and opioid products? It's again China and India. We see in the United Nations Office of Drug Control report in 2020 that, again, as I said, other than opioids, we find typically non-steroidal NSAIDs, which are basically the paracetamol, aspirin, ibuprofen, being used to treat severe pain conditions. How does cannabis help with pain management? As I said, cannabis treats not just pain but also treats inflammation. It is addresses both these angles of pain. Various reports. There's extensive studies about how cannabis has been found to be beneficial. So some of them I've just picked up here. About a study in the Journal of Cannabis Research, which spoke about people suffering from chronic musculoskeletal pain, finding up to 90% of these people finding it to be effective, those who used it. We find that it has analgesic effects comparable to morphine. Morphine, as you know, is after heroin, probably morphine is the most effective opioid. We see that, again, the number of respondents who say that it helps them is overwhelming, like 90% in various studies. We see that many of the people who are using cannabis to address pain are reducing their or completely stopping their opioid medications. Some studies have shown that cannabis with THC and CBD, that is in the ratio of 1:1, is better than many of the commonly used and prescribed pain medications. Cannabis reduces the need, of course, for using all these synthetic analgesics and anodynes. We see another study in the Journal of Cannabis Research talking about how the world's elite athletes, the ones who win the medals in the Olympics, are using cannabidiol for relief from pain, and how it helps them to perform more effectively. Now coming to the different classes of people or sections of society who use cannabis, we see that with increasing legalization, the section of society that is moving more towards the usage of cannabis, be it for recreation or for medicine, are either the young people between the age of 18 to 24, or it is the elderly people over the age of 65 and older. I had spoken earlier presentations about how the elderly are the largest growing, fastest growing group of people who are embracing or starting to use cannabis. The typical conditions for which they use cannabis are to either with the doctor's prescription or without prescription, they using cannabis to treat pain, anxiety, depression, and sleeplessness. It has been found that where cannabis is legalized, older adults are more likely to increase its use for medical and other purposes. Again, like I have said before, keeping cannabis illegal and keeping it in the black market, it prevents the people who need the cannabis, such as the elderly, the women, and the people with diseases, from getting cannabis. By keeping it in the black market, it only reaches the youth, who basically can find ways to access it, or the well-to-do people sections of society. But with legalization, the people who really need it can access cannabis. A study again report says that only 5% of those who used cannabis for their health felt that it was a risk to their health. Others felt that there was no, it didn't pose any dangerous risks. It has been found that cannabis helps with lowering rates of prostate cancer. Again, another condition that typically affects the elderly. I spoke about sleep improvement and about how opioid prescriptions fell drastically or significantly in places where cannabis had been legalized. We see cannabis is very effective for the elderly, especially because it is being used to treat neurological disorders, peripheral neuropathy, sclerosis. These are perceived as the by people over 65. Again, cannabis has been, I spoke about this in discussing the benefits to the heart, about how it reduces apparently the systolic and diastolic BP of older persons. It has helped older persons to reduce or completely stop using tobacco. It has been found that older people with cannabis usage have better or lower body mass index. Anxiety is one of the primary reasons why the elderly use cannabis. It has also been found that for people above 45 years, the prevalence of type 2 diabetes is much or significantly lower among cannabis users. And we see that because of the widespread conditions of depression and sleeplessness and pain, that the elderly, where cannabis is not being used, the benzodiazepines and the opioids and the analgesics are being abused, I would say, not misused. One interesting study that came up was that with medical cannabis being available, older adults were able to remain fitter and active for longer periods of time, and they were more ready and willing to work, and they were capable of working. So, especially in many countries where the populations are aging, the availability of labor for the workforce is a problem. But for these older adults who are using cannabis, they find it agreeable to work longer, and it also helps the economy. Typically, elderly people use cannabis as sublingual tinctures, and typically the ratio of THC is lower than it would be used for recreational purposes or by younger people. How cannabis is being used for women as medicine. We saw in the 19th century in India that there was extensive usage of cannabis. It is good to see that some of these or many of these uses are still being practiced today or increasingly being used. We find that women prefer non-smokable methods today as in the 19th century. One interesting thing is that almost 96% of women who use cannabis for the health say attest to its effectiveness. Cannabis has been found to help the female body, especially in improving sexual function, increased satisfaction, orgasm, and sexual desire. It has been found to be useful in menopause management and the symptoms that accompany it, especially hot flashes and night sweats. It helps to decrease the usage of opioids by women. It helps to treat various gynecological conditions, as these various science publications say. It is being used by women for treating refractory chronic pelvic pain. Again, myofascial pelvic pain, for treatment of again menopause or estrogen declines with aging, and helping to balance this out by reducing the deterioration of neural functioning and maintaining it. We see that there is an as it was shown in the 19th century, that as women move into midlife, they start using cannabis more and more, and this can be seen as a woman reaches menopause. Other conditions which cannabis is used to treat for women are endometriosis across various domains. Cannabis we spoke about its use to treat cancer and also to treat the symptoms or the side effects of cancer medicine, such as pain, insomnia, anxiety. So this is especially useful for women in cases of breast cancer. Studies have found that use of cannabis, where in places where cannabis has been legalized, there are no serious perinatal outcomes when it comes to women. We see that women are more likely than men to use medical cannabis when it is available to treat pain, inflammation, nausea. Women are also more likely to move away from prescription synthetic medicines when medical cannabis is available. We see this again confirmed in other studies where it says that women reduce their use of opioids and benzodiazepines. How is cannabis being used for children today? We see that cannabis, the journal Pharmaceuticals spoke about the potential of cannabis for treating autism spectrum disorder in children. We see science talking about how cannabis helped reduce febrile seizures in children. When again, in all these cases, cannabis is only used when all other treatment options have failed, and there is no way to go ahead. And as a last resort is when cannabis is used. We see that it helps reduce 50% seizure reduction in children with West syndrome. One of the main problems again is that the medical cannabis is and the synthetic anti-epileptic drugs are often too costly or even too difficult to source. We see that the cannabis is being used to treat the side effects of cancer in little children. Some of the problems that we see are that many pediatrics are saying that more they feel that much research needs to be focused on how cannabis helps with cancer in children. Physicians are recommending cannabis for cerebral palsy in children. It has been found in studies that cannabis usage for medical treatment of children did not affect their verbal episodic memory. So they were as effective, I mean, sorry, not in people suffering from medical conditions, but in general for young children, the use of cannabis did not affect their memory. It has been, there is a lot of linkage, or there are, one of the myths again is that cannabis usage by young people can drive them to suicide. But in fact, it has been found in various studies that it is a more effective treatment for depression than a cause for depression. So one of the studies found that it is people who suffer from, young children who suffer from depression were more likely to use cannabis later in life rather than people the other way around, as in children who used cannabis developing depression later in life. This is because I think as they understand how cannabis can help to modulate their mood. How is cannabis being used for animals? Again, in the 19th century, we saw cannabis being extensively used in India for animals. Today, also, the various diseases in animals or medical conditions in especially mammals which share similar body structures to humans, is that it is being used almost in many similar ways for animals. So anxiety, depression in dogs, canine B-cell lymphoma, age-related problems, and various other diseases that affect animals such as dogs, cats, cattle are being treated with cannabis. Farm Weekly published a report about how it improved digestibility in cattle, in farm animals. We see in the US that many of the state agricultural departments are funding studies to see how cannabis can be useful for animal feed. So North Dakota Agriculture Department is funding a study to see how hemp seed cake can be used and meal can be used for as chicken feed. Kansas State University has been awarded a grant to study how whether the use of animal feed containing cannabis gets transferred to the meat, milk, and eggs. We see the grants to University of Oregon for studying how cannabis biomass can be fed to cattle. We see Colorado State University talking about having a study of hemp seed for lambs. Similarly, in another university for goats. We see North Carolina State University talking about using hemp seed for horses. Again, all these things we see are mirroring how cannabis was being used in India in the 19th century. These are all being vindicated or justified in today's findings. We see how even for aquaculture, you can use feed can be hemp can be used as feed for aquaculture. Dog and animal food supplements, the CBD-based food supplements are doubling and even growing sixfold in terms of sales in the US. Now, who are the people who use cannabis today as medicine? We see that it is every class in society that uses cannabis as medicine today, as it was in the past. There is from the highest upper class to the lowest lower class, everybody uses cannabis as medicine. And even though, okay, I will not talk about that subject about recreation being medicine. We see, however, that the upper classes again have more access to the cannabis. They have the money power either to buy medical cannabis legally or to buy illegally from the black market. We see among the people who use cannabis today in different areas of fields, it is not, you find that the people who are the topmost benchmark people in these areas are all associated cannabis users and prominent advocates for cannabis. For example, we can see the scientist Carl Sagan was one of the biggest advocates of cannabis. We see sports persons today who are many of them retired legends of basketball who are now entering cannabis businesses, speaking in favor of cannabis. The armed forces is one area in which cannabis usage is completely forbidden, except in Canada, where cannabis was legalized. So it is unfortunate, to say the least, because the armed forces suffer immense pain and medical problems really because of their profession, but they are forbidden from using cannabis, but they are also pumped with synthetic pharmaceutical medications and alcohol and tobacco. The US veterans have been fighting for a long time to get access to legal cannabis, but they have been constantly blocked by the Republicans and the Department of Veteran Affairs from accessing cannabis. There have been multiple bills that have gone to Parliament, to Senate, and to the House, but they have still not been able to get access to cannabis, even though it is legal for medical use in 38 US states. We see an interesting report by the Saltware, which says that in Canada, as compared to the Department of Veteran Affairs in the US, which is blocking cannabis use for its soldiers, in Canada, the Department of Veteran Affairs spent 77 million on cannabis for its armed forces. This is more than the amount it spent for 12,000 other synthetic pharmaceutical medicines that were approved to be prescribed for veterans. So that kind of shows you the impact that cannabis as medicine can have for anybody. The top conditions for which cannabis is being prescribed today, I spoke about this. Again, these are the things which everybody in the world suffers, irrespective of where they are and how they are or who they are. It's basically pain, anxiety, depression, stress, and sleeplessness. The harm reduction journal published a report said that the main classes of medications that were being replaced by cannabis was pain medication, antidepressants, and arthritis medications. Patients were more likely to eliminate the dangerous opioids, anxiolytics, and antidepressants once they started using cannabis. It basically shows the conditions for which cannabis can be prescribed in the 38 US states. So this basically is a list of, not every state allows you to prescribe cannabis for every condition, but it is a collection of all the different kind of medical conditions for which cannabis can be prescribed in the various US states. So 38 US states have legalized cannabis for medical use, and this is the list of qualifying conditions for which a person can approach a physician to get a prescription for cannabis. You can see the extensiveness of the disease treatment. The medical cannabis industry today, now where cannabis is being used as medicine or where it is legalized as medicine, there is an industry that is in place which caters to the market. So the main suppliers of medical cannabis today in the world are Canada, Netherlands, Israel, Denmark, and Australia. Interestingly, out of these, only Canada has legalized cannabis for recreational use. All these countries typically supply cannabis to export to internationally through global medical cannabis companies. These companies typically have cannabis cultivated in places like Uruguay, Colombia, and African nations where the weather conditions are more conducive for high quality outdoor cannabis. And that cannabis is bought in arrangement with the government by these companies and then exported as medical cannabis to mainly Europe, North America, and Oceania. The main consumers of medical cannabis in the world today are Germany, France, Italy, Netherlands, Israel, Australia, Brazil, Argentina, Thailand, the US. Again, we see essentially the Western developed countries. Many of these countries are actively responsible for opposing cannabis legalization and supporting prohibition. We see that in the US, 38, as I said, 38 US states have legalized cannabis for medical purposes. The New Frontier data reported that the medical cannabis market in the US is estimated to reach 16 billion by 2025, and the main way that cannabis is being used is preferable method of consumption for medical users are smoking, though an increasing number are finding it preferable to have cannabis as edibles or beverages for as medicine. Again, the main classes that are being replaced by cannabis are anticonvulsants, glaucoma medication, anti-migration medication, nausea suppressants, and ADHD medication. The methods of administering cannabis, essentially, we see that it is for being used through combustion, that is smoking or vaping or topicals for medical purposes. And as I said, there is an increasing shift from smoking to using edibles for medical cannabis in different markets. All age groups typically report preference for cannabis in herbal form to any other form. But there are many pharmaceutical companies that are marketing cannabis as pharmaceutical products, such as Drobinol. These have been approved by the US FDA and are marketed as medicine, whereas cannabis, the herb or the plant, is kept banned, saying it has no medicinal value. The way cannabis is used again in administration is also as an external means. What are the challenges that cannabis is facing as medicine today? We've seen it being used so extensively, but what are the problems? Why can it not progress? We see that modern medicine is completely aligned towards allopathy. The course structures, the education, the whole system is aligned to allopathy. Most physicians do not say that they don't have enough information about cannabis to prescribe it. Most physicians are reluctant to prescribe cannabis because it comes outside their scope of their experience and knowledge. Opioids and other synthetic pharmaceuticals greatly benefit a number of physicians who, in the US, there was rampant over prescription or illegal prescription of opioids that has also been one of the contributing factors for the opioid crisis. Um, we see that the synthetic pharmaceutical industry again will fear cannabis because people will reduce or completely stop allopathic drugs, as these studies show. The problem with medical cannabis today again is that you need a prescription from a registered physician, and it is higher cost than a natural herb. So again, it is only the upper and middle classes who can access cannabis, and not the majority of the people of the world who are the poor. Uh, Cannabis, we see both from the 19th century studies as well as what's happening in the world today, that cannabis is the number one universal medicine that should ideally be available to everyone. Why? Because it is one medicine that can treat, we saw the range of illnesses that it can treat. We see that cannabis prevents disease rather than being used to treat disease. We see that cannabis can act on specific body systems without causing damage to other surrounding systems. We see that cannabis can be administered either internally in various forms such as solid, liquid, or vapor, or it can be administered externally as oils, creams, lotions. We see that cannabis has a high safety profile. That is, the effective dosage to the lethal dosage ratio is very, very high. So even if you take 10 times or even 100 times the prescribed dose of cannabis, you will not die. Whereas with a synthetic pharmaceutical drug, even if you take, say, 0.5% of the prescribed dose, you might die. The cannabis can be administered to people of all ages. As we have seen, it can be administered to people of all body constitutions, races, across the world. If it is fully legalized and made into a commodity, a crop, it can be grown and available practically everywhere. It can be used for long periods of time without serious side effects. The problem with the typical synthetic pharmaceutical drugs is that the longer you use a synthetic pharmaceutical drug, the more risks increase, because they have not done longitudinal studies and on these drugs. Cannabis has a longitudinal study of, say, 15,000, 10,000 years across billions of people. It is compatible with other medications, with food, various foods and drinks. So you don't have to worry about, oh, I'm using cannabis. You can, with cannabis, you can take any of your other medications. It does not react with it. The impact of a person when using cannabis is minimal. So whereas typically with synthetic pharmaceutical drugs, the impairment levels can be so high that it can make a person non-functional, especially the elderly or the weak. We see that cannabis is not at all highly addictive. One of the other key benefits of cannabis is that the whole process of using cannabis as medicine is basically using a plant as medicine. It does not create the damage or cause the damage to the nature that synthetic pharmaceutical drugs do through manufacture, processing, disposal. So cannabis is essentially universal healthcare. If the world today wants to achieve universal healthcare, and it's very simple and straightforward, but it can be achieved through cannabis. It can help to, by completely legalizing cannabis, it will be available to all sections of society. Again, as I say, the main sections of society that need to access cannabis are the poorest people, the elderly, the very sick. Like I said, as a crop, it can be almost free of cost. I spoke about how India is a significant part of its come from the active pharmaceutical ingredients that it imports from China to make the various synthetic pharmaceuticals. We see from the combined conditions that cannabis has been used for in the 19th century and in modern medicine, that the conditions are running in the range of about more than 50 medical conditions for which cannabis can be potentially used as treatment. And what I say is that we are still seeing only the tip of the iceberg, because we are only now again studying cannabis in that level of detail with our modern scientific techniques. Before I close, I'd like to just quote three sources. So one is the Internal Medicine Journal, which talks about how cannabinoid-based medical products are effective across multiple conditions. So it's and how it is well tolerated. There is another study by Normal which shows that increasingly the amount. Sir, time हो गया. Sir, 2 minutes. Okay. So we see that scientific publications have been grown exponentially in terms of how or regarding cannabis for science and for medicine. This has to be accessed by people, and more studies have to be done to, and this will only happen as we go. See again from the longitudinal studies that the main drawback of cannabis was that people who used it showed low periodontal health, whereas a tobacco user had all these other problems which were associated with using tobacco for a long period of time. For more information, I really recommend that people also who are studying cannabis medicine also refer to these various international sources which are bringing high quality studies of the latest findings, and that will help us to understand the use of cannabis as medicine better. Thank you. Sorry for the delay.
Thank you. Thank you very much. Really, you are the portion of the knowledge regarding cannabis. One man reference book, I can say, no doubt. Great effort, Koshiji. Great effort.
Thank you, sir. Pleasure.
I will touch you over phone. Thank you again. Thank you for. We can't take questions because time is over actually. But your speech was mesmerizing, so there was no possibility of stopping or interrupting you. Really.